it's Will Potato Strong here. I'm delighted to introduce you to Patty. I met her down in Costa Rica at one of the McDougall adventures, and she has a really amazing story, surviving breast cancer and changing her diet and all the things that she experienced during that time. So I thought you guys would be really interested in that. Hopefully, it'll help you or any of your loved ones now or in the future if you ever have this type of situation. So, welcome, Patty.
Thanks. Thank you for having me. I appreciate it.
Yeah, it was so much fun down in Costa Rica and the adventures and chatting with you. And
Yes, I agree. I had a good time. Some of the bus rides were a little long, but I really enjoyed having that time to have a nice conversation with you and Bonnie.
Yeah, it was great to chat with you, and it definitely helped pass the time, especially on the bus.
Yeah.
So you're in Austin, Texas. Is that where you grew up?
No, I grew up just outside of Philadelphia, Pennsylvania.
Okay. Yeah, sometimes people, they might live in that area, or they may want to at some point ask you questions or contact you, and it's interesting to find out where people are living.
Definitely, yes. If anybody wants to contact me about what I'm going to talk about today, I'm more than happy to meet anybody who's interested in learning more.
Yeah, once it's on YouTube and that, there'll be like in the comment section and potentially on my Potato Strong page, there might be some questions, so we can keep an eye out for those
Great.
After the fact in case we miss anything. But so the first question would be, does your family have a history of cancer, in the past and that?
Yes. I had two aunts on my father's side who had it's from what I understand, they had stage 0 breast cancer, which is called ductal in situ carcinoma. And they were both older than me when I was diagnosed. I was diagnosed at 41. And so that's about it. But they have many, many daughters and granddaughters, and none of them were affected by breast cancer. And a lot of them are older than I am as well. And then my mother, when I was 12, she was diagnosed with laryngeal cancer, and by the time hers was found, it was a slow-growing cancer, and it was misdiagnosed for about 5 or 6 years. And by the time that was found, it had spread considerably, and she only survived about 5 months after her diagnosis. Mm. Yeah, and she actually passed away from the treatments were very brutal, and she died from the treatments.
That's horrible.
Yeah, it was.
So, did that make you worry at all about potentially getting cancer in the future, or did you think that was just a sort of a chance situation?
Oh no, it did make me worry a lot about it. So being worried about my health, starting from a young age and seeing what my mother went through, cancer is it's hard on anybody, and cancer treatments, but I really think, laryngeal cancer is, boy, it's terrible because it's your neck, and she had radiation treatments. Her neck was very badly burned, and so, I would smell the burning of her, of her skin every day, and she was coughing all the time, and it was just a horrible, horrible way to die, the way she died. And so seeing that, I was like, yeah, definitely want to try to avoid getting cancer, given that I had seen what my mother went through. So I was very focused on eating healthy and getting exercise, and so I was very interested in eating organic foods and lots of vegetables and brown rice, and not drinking, very much alcohol at all, and not smoking. And so just growing my own garden, I took a lot of pride in the fact that probably about 2/3 of my front yard is garden. So I thought I was doing everything right. Mm-hmm. Yeah. And so that's why I was very, very surprised when I went in for my medical checkup just after 40 years old. I just turned 41. And, I was told I had breast cancer from that. So it was very surprising. I thought I was eating probably healthier than just about everybody I knew. I mean, just 99% of the people I knew. I was up there. People thought I was a healthy eater.
So what year was that?
That was in 2012.
Okay. So you ate pretty healthy. How much, from the meat and dairy and oil and that sort of thing, how much, what percentage do you think that roughly was, like, of the diet?
I think like my husband, I married my husband 16 years ago, as of now, and he's Chinese. He's from China. He's from Shanghai, China, and he actually introduced me to a much healthier diet than I was on previously. And so, definitely less meat and more vegetables, lots of rice. So I was doing that, but we bought meat occasionally, we would buy meats like to flavor our stir fry dishes. So maybe we'd go through about a quarter pound of pork or something, or maybe a little more in our stir fried vegetables. But a lot of times we just have vegetable meals. But maybe we buy about a half a pound of meat a week, and then maybe every other week we would buy a whole fish, and we would on a Friday night we would eat the whole. It had the head and everything on it, and we would just kind of gorge on that while we're watching a movie, like a video on Friday night. And then every now and then, maybe 2 or 3 times a year, if we had somebody over, Texas is known for its barbecue. And so I would get some barbecue ribs, but I kind of thought, well, I'm eating so healthy. I'm growing kale in my front yard. All the kale I'm eating is going to cancel the bad effects of, I knew meat, was probably not very good for you. I had that instinct. But I was like, well, I'm eating so much vegetable, it's canceling out. So you have acid, you have acidic, they're sort of, evening each other out. And I thought everything would kind of even out to a neutral state and not damage my body. I never had that, I never ate at McDonald's. I never ate at any of those fast food chains, before. But, we did eat the meat occasionally and stuff like that. And oil. We did use oil. We made a lot of stir fry, and I was copious with my use of oil.
Mm-hmm. Yeah, that sounds really healthy.
Yeah, I thought it was, but I learned a lot in the past few years, and I guess we'll talk about that. So.
Yeah. Okay, so you were 41. You found out you had. So, can you go into detail about how you found out that you had the breast cancer?
Yeah, I went to the doctor every couple of years. In my adult life, I've never had any health problems. I wasn't really considered a risk factor for breast cancer at all. So I know I saw the little, those posters in the doctor's office about how to do self-exams, but I always ignored them because I never thought I was the kind of person that needed to do that. So I went to the doctor. I was like, I just turned 41. I want to get a good baseline of myself before I begin to deteriorate as I get older, So I went in and I was like, go on, let's do the checkup. I want to have a good baseline for my 40s. And then the nurse practitioner I went to, she didn't say anything to me about, it's indicated in my file. I saw my file later on that she felt a lot of density in one of my breasts on the very specific side where it was. And then after the exam, she asked me to go have a mammogram. And so I was like, sure, why not? Just check it out. I just was like, yeah, no problem. And so I went in and had the mammogram. And then the mammogram place called me maybe 2 days later. They called me at work and said, we want you to come in for a recheck. And I was like, oh, well, where do you see the problem? And then they told me where, and so then, I put I made the appointment and I put the phone down and I went to the restroom the first thing and I was like, oh yeah, I do. I feel it. Yep, there's a lump there. And then I was like, but, I have had lumps before. I went to the doctor a couple years before because I had lumps. But they were a different kind. They were painful. And she thought it was due to my caffeine. And she said, cut the caffeine, see if they go away. And they did. They went away, and I never thought about it again. Different breasts. So I know it wasn't related. But, so I was like, yeah, okay, go in. And then that's pretty much, I went to have the mammogram done, and then they mentioned they saw calcifications in there. And I was like, oh, okay, I don't know what that means, but guess they want to look at it. And then the doctor came in, this doctor I never met before, and then she said she wanted to biopsy it. And then so she was like, when can you come in for the biopsy? And so I was like, well, let's do it today, because she offered me the same day. So she was like, all right. So then I had about 2 or 3 hours to sort of let everything brew. And then I did a little Google search when I went home for a few hours to get lunch. And I looked up calcifications, and then it says, there's a high chance there's cancer there, and there's calcifications. And then, and then I started to get a little worried.
Yeah.
So that's how that went down. And then, I went back 2 hours later, and I was arguing with the doctor about, she wanted to put some clip inside, some metal clip on the tumor. And I was like, I don't want anything in my body, And so we were sort of arguing about that when she was, I don't want anything permanent in my body that's metal, and she had the picture of my big black, on the ultrasound, my large black cancer tumor, and she was like, she said, well, this is cancer, and that's how I found out. And I was alone in the biopsy room, and I was actually bleeding all over the gown I was wearing, and she told me I had cancer, and I think that was probably the lowest point of my life. Yeah, it was pretty awful. So that's how I found out.
Yeah, I can't imagine. It's like everyone fears that, getting that diagnosis.
Yeah, it was a real shock. I wasn't expecting it at all. It was, and then, it was just a lot, she's like, you need to go see a surgeon now. And, and then then there's a whole other process afterward, that's just makes your life an entire nightmare. Waiting for the official, diagnosis, going in for additional tests and things too. They want to have everything figured out by the time, you go in for your surgery.
So do they check to see if it's anywhere else, if it's spread, before they do the surgery?
Yeah, they do. They before you go, you can be I guess clear or whatever for surgery. At least in my case, I think it's pretty common. But they send you in for an MRI exam of your breasts, and so you're in that large MRI machine, and it's checking all your lymph nodes, and it's doing a really detailed scan of your lymph nodes and your breasts and everything, and so I had that done, and then the surgeon I was seeing at the time called me and said, "Oh, well, this is interesting because they found like a suspicious area in your other breast." And so I was like, "Oh man, oh my God," And then I had to go back for another mammogram, but the mammogram didn't see it, but only the MRI saw it. So they wanted to biopsy it, but they needed to do a special kind of biopsy, which is an MRI biopsy. Well, then it takes a long time it took a long time to schedule that appointment because they got to get the doctor and the equipment all lined up. And so I had to wait a whole month before I even knew if I had 2 cancers or 1 cancer. And so, I was presented with surgical decisions, and I had no idea what kind of surgery to have. I don't know if I should have one side or or just maybe just take them both off, or So it was a really hard time. I had this whole month to to think about this and figure out what I'm going to do. And so that kind of launched me into the next phase of my cancer process, which was research. How can I help myself right now? Because I'm worried. I know I have cancer in my body, and I'm worried it's going to spread. I don't want to do anything that's going to make it spread, before the surgery, because if it spreads to my lymph nodes before the surgery, then I'm definitely going to need the chemo.
Yeah.
But in some cases, some people's cases, if it doesn't spread to your lymph nodes before the surgery, then they don't recommend the chemo, and that's what I was trying to aim for. And so I was like, how can I help myself now? But then how can I help myself also in the long term? So I was seeking a lot of advice on alternative treatments and what can I do with diet and everything. And so I took time off work. My company was nice enough. They asked me, hey, do you want to take some time, to focus on yourself? And I was like, yeah, I really need it. And so my husband already got started, and he ordered me a ton of books on cancer. And then I watched a couple of movies, and I got a lot of books on it. And then I just started really digging in. I sat in my backyard, and I just started reading, underlining, asking questions. So it seemed really good in the beginning. You'd think you would kind of get to an answer that way. But what it ended up doing is it made me really, really confused. I just ended up with so much conflicting information about what to do for the cancer and what to do to help myself, that it ended up being more detrimental than helpful. Because, it was like I knew automatically don't eat meat because I've heard of the Gerson therapy and the macrobiotic therapy, and I know they don't have meat. So that was already out. On my day of diagnosis, I was like, I'm not touching it anymore. Meat and dairy and all the eggs and everything. But then, when I started reading further, it was like, well, this resource says that grains cause inflammation and can lead to cancer. And then this information said potatoes are nightshades and tomatoes are nightshades, and those I should stay away from them because they can lead to cancer. And fruit, not even fruit is not even innocent because fruit has sugar in it, and sugar can lead to cancer. So there are all these different kinds of fruits I should avoid. Yeah. And then, of course, like soy, right? It's like, and then my husband being Chinese, that was a regular condiment in our diet. So I was like, well, I don't know what the heck to eat. I was eating, I started just eating oatmeal all the time. Just plain oatmeal. I didn't see anything bad about oats in the whole thing, but it was just a very trying time. Then I was also reading about the Gerson therapy, and so I attempted like juicing for a few weeks, and I was just, they drink it every hour. They have a fresh squeezed glass of vegetable and fruit juice, and so it's very difficult to maintain that kind of diet. Technically, if you do the Gerson therapy right, you're drinking fresh pressed. You're basically chained to your juicer for 2 years, drinking fresh pressed vegetable juice for 2 years. So I tried to do it. I wasn't doing it right or accurately. I would make all my juice in the morning. And this is when I was still working, but I'd have my 13 jars and I'd take them to work, and I would just be like drinking them, during the day, and I wasn't eating anything. So I was losing weight, losing a lot of weight during that process.
So you first got told that you had the cancer, and then they were still doing tests before they decided, or you guys decided like what if you do surgery or if you needed radiation. So during that time, you were doing a lot of research for yourself, and then did you go back? When the tests were done, how much time was passed before they, would come back with a plan for you, like for surgery or anything?
Yeah, it was. We were talking about plans like during that process, like, okay, well, if the other thing turns out to be cancer, then there was a lot of if-thens. It's like if that turns out to be cancer, but then you have to know how house, it might not be exactly like the other one. The one they found, they said, well, it's not very aggressive, so if it's not spread anywhere, and if it doesn't turn out, like during the surgery, they don't turn out finding more things or finding additional stuff during that biopsy, it's possible you can get away without the chemo. But then there's the unknown in the other side. And so then it was like, I was like, well, if it's this, then this, then this. But then if it's in the other, because what they ended up saying is they did the MRI biopsy on the right side on my other breast, and then the results were inconclusive. Like they didn't know. I mean, it was like we didn't. The pathology report said, "Are you sure you got the area? Because this just looks like normal tissue." And why don't we just check it in another 6 months? And I was like, what am I supposed to do with this? I'm going to treat this cancer now and then 6 months have to deal with all this all over again. And so, this as far as the decision tree, if I do lumpectomy and radiation on this side, and then 6 months later have to do lumpectomy and radiation on the other side, I don't want to have radiation, go through radiation twice. I would rather probably just have a double mastectomy in that case from the choices. So it was like my decision tree looked like a bowl of spaghetti at that time. It was, and so they ended up recommending that I treat the known cancer for now, and then testing the other side 6 months from now. So. It left me feeling extremely uneasy for quite a long period of time.
Yeah, the mental, we've had various issues, even my dog and that, and I find that, the mental anguish or the uncertainty, until you kind of get that all nailed down, it's pretty hard emotionally. And
it is very,
confusing.
And it's like I went through like several times like that during the whole, those past couple years, from the cancer, and it's just harrowing. You get checked for something, and then they think they find something, but they're like, let's check it in 6 months, and then you're thinking, that's on your mind for the next 6 months, and it's definitely not a very good place to be. I wouldn't recommend it for anyone. Yeah.
So you finally went in to just focus on the one lump that they knew was cancerous?
Yes, and so that they recommended from all the pre-testing, they said, do the surgery, have your lymph node biopsied, and then do radiation. And so, I did. So I was very reluctant to do the radiation and the lymph node biopsy, and I called the doctor several times during that process, like, I really don't want to do the radiation. And the surgeon said to me, the surgeon I was working with at the time said, I'm not going to operate on you if you decline the radiation, And so because I saw what my mother went through undergoing radiation treatments, I was, I already had this, this fear of radiation.
Yeah.
And also, from everything I read on the internet about, what it does to you, especially left side, mine was on the left side and my heart is on that side, and what kinds of important arteries and everything are there being exposed to the radiation. And then, and people end up with heart damage as well.
Yeah.
And so the lymph node biopsy, a possible result of that is you could end up with a swollen arm, and you're basically spending the rest of your life managing your swollen arm. And you have to wear this sleeve, and you need to have a lot of physical therapy done. And if you don't take good care of it, you could ultimately lose your arm. And it's terrifying. And so I was like, I don't want the lymph node biopsy, and I don't want the radiation. And but then it was like after a while, they ended up talking me into having that done. But had I known Dr. McDougall, his writings at that time, I would have seen all the science that supports not doing radiation and not getting your lymph node taken out, and I would have had a lot more support, and I definitely would not have had those done had I had that information at the time. So,
So
you
the
know,
so
if
the
anything, that's the first thing I tell people. If I know anybody that has breast cancer, I try to give them that information.
so the radiation would be where the lump was removed to kind of make sure they get all the cells destroyed.
Yeah, what they do is well, what they, especially in women my age, they want to do whole breast radiation. There's other kinds that's just localized, but they said I was too young to qualify for those. That they put something inside and they just radiate around the area. They did the surgery, but because I was under 45 at the time, they said the only kind of radiation you qualify for is whole breast radiation. And so they do everywhere there's breast tissue. So there was just this big area, across my chest that had the radiation
Yeah.
done.
I, s-
And
I
it's
s-
for like an entire month. I had to go in every day.
wow. Yeah, I sort of had a feeling nowadays that the radiation was pretty targeted, but I guess that's not really the case in that situation and probably others.
No, there was like an experimental. I was thinking about doing it. There was some experimental stuff being done in Stanford University in California where they actually do the radiation like during the surgery. Um, they give you one shot. They put something behind to protect your heart, and they give you one shot. I was thinking about doing that, but it was just really hard to line up the schedules of the doctors there and my schedule and flying out there. And I was like, I'll just do it locally. But yeah, that was one option I had where it was more targeted. But now I know. I mean, I wouldn't have had any radiation done, if had I read Dr. McDougall's book, The McDougall Program for Women. And he has the information on his website too. He shows that getting radiation, all it really does is it prevents the local recurrence, but it doesn't prevent distant recurrence, that's the life-threatening kind. And so, he talks about all the process of how the cancer spreads in your body. And it's like by the time that cancer grew to the size that I had, it has been growing in my body probably for 17 years. And if anything the cells have already spread through my body the way it's explained by McDougall, which he's getting everything from the studies that he read. Everything he has is supported by peer-reviewed research. So, but the cancer, it's not just starting in the breast and then spreading everywhere. It's by the time it grows to a cancerous tumor in your breast, the cells are already spread in your body. So getting localized radiation isn't helping anything. It's just keeping it from growing again in your breast. But I mean, that it comes back in maybe 40% of the people, but then there's 60% of the people it doesn't come back. So, I would have been happy with that. And then if you look at the study, it shows the people who had the radiation, the people that didn't, actually the ones who didn't have the radiation are the ones that lived longer.
Hmm.
Yeah, it's pretty crazy. I'm like, why are they even recommending this to people?
Yeah. Yeah, a lot of the treatments are probably more harmful than not doing anything or doing other approaches.
Yes.
For the biopsy in the lymph node, that would be less severe than the full removal of the lymph. Like it's just a little sample, or is it?
Right. They just took one lymph node, that's standard now, thank goodness. Maybe 10 or 20 years ago, they just took all the lymph nodes, a standard process, but then they realized so many women were suffering from having all or many of their lymph nodes removed that they had some study that showed if you just take one lymph node out, that's enough. But there are some doctors nowadays who still take out many, many lymph nodes. And I made it really clear to my doctor. I wrote it on my pre-surgical form where I was signing out. I said, you're just taking one, that's it. If you see cancer anywhere or you want to take more or you're not sure during the surgery, I said, close me back up and talk to me about it afterwards. But I only want you to take one because there's less risk from lymphedema. But I know people that just had the one lymph node removed and they suffer from lymphedema, even with the one lymph node. So,
and they do that.
I'm lucky that I had a little bit after my surgery, but I'm managing it, and I think it's probably because of my diet and exercise.
So so they do that to see if it's spread, and is that right? They look at the lymph nodes to
Yes,
see.
yeah. Like what they assume is if there is cancer in your lymph node, that the assumption is if there's cancer in your lymph node, then it's likely to show up. It's already in your lymphatic system, so it's already, spread in, possibly spread in your other organs or whatever. And then they do then they recommend chemo definitely. If it's in your lymph node, then they go ahead and they recommend the chemo treatments. You know,
So you were
and
saying
so
that at that size of tumor, it's pretty much in your, it's spread or it's systemic. So did it show that did the biopsy show anything in the lymph nodes?
no, it didn't. It didn't. So it didn't show up in my lymph node, thank goodness. So they didn't recommend anything else. But it wasn't the cancer doctors that I went to that said by the time it gets to mine was 1.7 centimeters, and so they didn't say anything about by the time the cancer cells become a tumor, it's spread. That information I got from Dr. McDougall and some other doctors who bring to light the other studies that show that on average it takes about 10 years to grow a tumor that's 1 centimeter, and during that time the cells have already spread. It's just, will those cancer cells that have spread throughout your body, will they eventually become a tumor or not? And so that's kind of the question. And I'm like, yeah, there's I know from that the cancer cells are spread, but what can I do to help myself from preventing that to become become a tumor somewhere,
So
and then really wreak havoc in
yeah,
different areas.
yeah. So you had the surgery as you were learning, but you didn't really have like some of the knowledge from McDougall and that until after.
Yeah, not until way after. So I had the surgery, and during that time, I was cobbling together various information that I got from different places. And, I was losing weight because I was afraid to eat a lot of the foods that I was eating. I was like, I didn't want to eat rice, and I was afraid of potatoes. And so, I was just, and I don't know, I was just generally afraid to eat anything. And until I can figure out, kind of a consistent mechanism, a consistent thing that just made sense to me, that I can help myself. And then everything I found was inconsistent, so I was really confused. And so I was like, well, let me see a professional. Let me go see somebody who's a professional diet. And then there was this one person who's recommended amongst a couple of the some of the breast cancer folks around here. He said, oh, go to this guy, he's really good. So I went to him, and I waited a while. I waited about 2 or 3 weeks to get an appointment with him. And he's a nutritionist, not a dietitian. But I think he does really well. But I told him that he was recommending a diet that I was already eating before I had the breast cancer. I was eating clean, organic meats, vegetables, and oil. He didn't say anything about oil. I didn't even know to ask that at that time. But just everything clean, and go out and get some exercise. And then he recommended a few supplements, but I'm not really into that. And so I left there thinking, I said I want to be vegan, and he was like, no. I said I'm not eating meat, and he was like, well, what are you basing that on? I'm like, well, the Gerson therapy, and he was like, well, the Gerson therapy is not researched. Not very well researched. It's just based on what somebody thinks. Are you going to base your diet on just that? And I was like, I don't know. And so I just left there, and I was like, I didn't really get much out of that. So I was like, let me see. There's a dietitian at my oncology office. Let me go to her and see what she says. So I made an appointment with her, and it was worse. It was, oh my God, it was like so much worse. That appointment was terrible. Well, first thing, when I went to her, I was down to about 100 pounds. And normally, I think I was at about, maybe I was 112 or 115 before all this. And went to her, and she said, she had me weigh myself, and then she asked me to email her my weight or text her my weight every week. She was worried about me getting thinner. But she said, I'm very worried you're not getting enough protein. You need to eat meat for protein, and you need to eat. I was like, I'm off meat and dairy. She's like, nah, we'll get you back. We'll get you back eating that. And she's like, you need to eat like yogurt, like fat-free yogurt, and 3 servings of dairy because your bones are going to disintegrate. You're not getting your calcium. And so that, I left there. I was like, oh, this is terrible. And I went home, and a couple times I woke up in the middle of the night, and I was like, I wonder if my bones are disintegrating right this minute. And so I just felt like in despair, like I wasn't getting an answer anywhere. I had all these confusing books and a lot of confusing internet research. And so then it was like a few months later, like Livestrong. Have you heard of Livestrong? They're like, Lance Armstrong's organization.
Yeah.
And so they have seminars, and actually they're headquartered here in Austin, which is great. But they had a presentation on nutrition for cancer. And so I was alerted to that. And I was like, oh, this is great. Let me go see what they have to say. Maybe I can glimmer some good information out of there. And so I went, I sat in the front row. I was like, let me hear what let me see if I can get something from this. And then the person who was presenting was a dietitian, and she was actually a dietitian at some large cancer hospital up in the Midwest. I can't remember the name, or the West Coast. But she said, need to decrease the meats, need to avoid dairy, and limit oils. And I was like, oh my goodness, I think I can learn something from her, because I never heard about limiting oils before. So I asked her a few questions after her presentation, and I signed up for an appointment with her. And I was like, yeah, I said the meat and the dairy, I said I was already doing that, and I haven't gotten confirmation from anybody that I saw professionally about this. Oh, and the surgeon I was seeing at the time, and the oncologists, they were all like, it doesn't matter what you eat. Just eat whatever you want. It's not going to affect anything. And so that was the answer I got from the doctors. And so anyway, I heard this from the dietitian, and I had a meeting with her like a few days later, and she told me about the China study, and she gave me information about soy. She said, you don't need to worry about soy. So actually, people that eat soy that have breast cancer actually fare better than people who don't. And so she gave me lots of assurance, and then I picked up the China study, and I read that, and then it's all history from there. I just went, the China study, it's like so many light bulbs went off, and then I followed that on with Colin Campbell's book Whole, and I just couldn't believe it. I said, oh my God, I wish I had this information a couple months ago. And then, but still, like I wasn't eating enough at that time, because I was gaining some back, but not that. I was still kind of not, my energy wasn't that great because I wasn't eating enough. And it's because, I realize now, it's because when you're eating low-fat vegan food, your portions have to be so much larger to get the same calories as you do when you're eating oil. And so I was still filling my plate like to the same amount that I was before. But I wasn't getting the same calories I had before. So, and then it was finally, I took the E. Cornell class. It was T. Colin Campbell's class through his Cornell University. And that was great. I took the 6-week class. I got a little certificate at the end. I learned a lot. And then they had John McDougall, some information on John McDougall in that class, and that's how I learned about him. And I bought the Starch solution, and it was in that book that I learned, oh, I need to eat more. I need to eat starch. It's going to sustain me. And definitely potatoes and rice are my friends and not my enemies. And so since then, I've just gained muscle, and I have a lot of energy, and it's just amazing that just so much that I learned, and there's so much science out there supporting this diet for preventing breast cancer. I just can't believe it's not mainstream information, and I hope that someday it will be. I know I was searching very actively for it And I didn't get this information until, maybe a year later or something. I don't know. It felt like a really long time.
So when did you have the surgery for the removal, the lumpectomy?
I had it in May of 2012.
So after that, did they want to see you on a regular basis afterward, or check on how does that work when you post-op? Like, do they follow up and then spread them out longer and longer periods if it doesn't?
Yeah. Initially, they saw me every 3 months, and I would go for a follow-up mammogram and everything. And all of my follow-up mammograms were fine. Everything was fine. I didn't have any drama. Actually, I did that 6-month follow-up of my of the suspicious area on the other side, and did an MRI for that, and that they didn't even see anything the next time they did it. So that's good. I don't know if it was like, because I cut the meat or whatever, or maybe it just would have gone away on its own, whatever that was. But I don't know. I just feel like everything I did is just very health supporting. All my appointments are, and then, okay, so it was every 3 months, and then they stretched it out to 6 months, and then they said, yeah, we don't need to see you for a year, and just do mammograms every year. But I had since decided not to do any more follow-ups. And that's also based on Dr. McDougall's advice is, it's not really a good idea to go looking for things if there isn't anything there. Mm-hmm. And based on what I read and all the, what he has to support that, I agree. And so I'm not going for mammograms or MRIs or surgeon appointments or oncology appointments, unless I notice any symptoms, then I'll go. But as long as I'm symptom free, I'm just going to move on with my life and enjoy myself and not, because I noticed when I kept going for the follow-ups, I felt like I was under this cancer cloud. It's like I'm constantly having to think about cancer. Like, I have the gynecologist and then the surgeon and then the oncologist and the mammogram. So then I needed to spread those out during the year. So it's like every 2 or 3 months, like I'm having to think about it again. And I don't want to have to think about cancer all the time like that in my life. And it was just a real nice relief to hear that Dr. McDougall doesn't recommend. I even emailed him. That was one of my questions that I emailed him. I said, what do you think? I know you don't recommend mammograms in general, but what about for people who've had breast cancer? You recommend it then? And he was like, no. If the cancer is there, you'll feel it, and at that time, you can take care of it then. But trying to find it any earlier than the point you can feel it, it's not going to change your prognosis. So that made sense to me. And I was like, yeah, then I don't have to be under the cancer cloud all the time, trying to find things, that might be a problem, and then having to follow up on things they find and all of that. Yeah.
Do you think you would have detected it on your own if you didn't have the mammogram?
Yeah, that's a good point, because, it was there, and I wasn't very aware of, I wasn't aware of self-exams, as much as I should be. I was kind of ignorant about it. I think probably eventually I would have found it. If it got bigger, I would have noticed it. Yeah. But, like he says, if you notice it in the shower, then go. But Dr. McDougall doesn't even recommend doing breast exams. Because people find things and then it turns out to be nothing, but it sets off this whole cascade of, medical treatments and lots of checkups and things. And at the end of the day, when it becomes big enough that you feel in the shower, it kind of brings your attention, you go to the doctor, it's not going to change anything about, your prognosis anyway. So, he's definitely against the whole, try to early detection and all of that, because there's studies that show early detection doesn't really improve survival at all. it finds more cancers, but when you look at overall survival, it doesn't it doesn't do anything.
Yeah, I noticed that. Like for you and I think it's common knowledge, I guess, at this point because we've watched and listened and read books on health and nutrition. But for anyone watching that, I think they'd be surprised to to hear that you were saying and I'm saying that not to do mammograms, not to do self exams.
I know it's a very difficult concept.
It seems counterintuitive. Like if you have something and you take it out, then it's not going to grow and potentially spread, or it'll be too late. If you wait till it's detectable, or you wait till you have some stomach problem, and that means it's already in your, it's spread to other places.
Right.
Do you want to talk? I didn't. What can you just say about that aspect? Like you said, the studies showed basically that they detected it earlier, so it seemed like you lived longer, but the people didn't live, any longer than they would have without the.
Right. They basically just knew they had cancer longer. It was very interesting. Even, and I've seen it before in his books and Gilbert Welch's book, Overdiagnosed. He talks about it in that book too, but Dr. McDougall also talks about it that, it's finding, okay, so say somebody, that they they say they're 40 when they die of cancer, and say there's twins, right? I think they say it's like you have like a set of twins, and they both die of their cancer when they're 40, but there's the one twin, like she feels it in the shower and she goes at 37 years old. And she goes and gets it checked and everything. It turns out it's cancer, and then she dies when she's 40. But then there's the other twin sister who she's 30 years old, and she goes in for the mammograms and tries to find things early. And so she finds it at 30 years old, and she goes through treatment and all that stuff, and she still dies at 40. And so the one that did the early mammogram, she spent 10 years of her life knowing that she had cancer and being treated for it, whereas the other twin who found it at 37, she had 7 years of her life not knowing she had cancer, and then just the last 3 she knew she had it.
Yeah.
And so they have research and everything showing that's pretty much, all that early detection does is you just know you have the cancer longer. And so, and there was other stuff, reading The Pleasure Trap now, and in the beginning of the book he actually talks about the chemotherapy benefit, and there's actually very little benefit, and Dr. McDougall talks about that too. But in The Pleasure Trap, he talked about the statistical number they assigned to the car. Like, I'm not good at these terms, but it says pretty much like the benefit from chemo, and if there's a strong correlation or whatever, then the number is it's like from 0 to 100 or something. And so if it's like 50 and above, then that means there's a strong benefit. But if it's like 15 and below, there's not very much benefit. Mm-hmm. And so they showed, like with chemotherapy for breast cancer, the number is only 10. And then in another study, it showed the number is actually 3. And so it's like very little correlation for the benefit of chemotherapy. So, but, that's the sad part is, it seems like the treatments don't really help improve the survival. But there's a lot of books I read that show that diet can help with it. The best thing you can do for your cancer is to go on a low-fat plant-based diet. And Ruth Heydrich, Dr. McDougall's patient in the 1980s, is an excellent example of that. And she was diagnosed, her cancer was way worse than mine when it was found. Hers was stage 4, and it had already spread, to her bones and I think her lungs. And she's already alive like 40 years later, from her diagnosis. And she didn't do the chemotherapy, or radiation. She had the surgery to remove the breast lump, but that was it. and she's still thriving, and she runs marathons like all the time, and triathlons. She's won like 1,000 gold medals, and she's just very inspirational. But she's an excellent example of somebody who, through diet and lifestyle change, she was able to help herself survive. And that's what I'm trying to do too. I'm like, I don't want to wait for it to show up as stage 4. I'm going to just try to do something about it now, and then also, I mean, at the same time, this diet, this low-fat plant-based diet, I mean, I feel amazing. Like I've never felt so much energy before, and it's and can do so much. Like I've never ran before this. I could never even run a mile without chest pains, and now like, I can run 8 miles, and I don't even think about it. It's just amazing, my stamina and everything. So there's just no way I'll go back. And then you get used to the food. You might think it's kind of boring or something at first, but your taste buds change, and then they wake up to and it's just amazing. There's so many great recipes. Like your website has great recipes that people can use. I'm going to try your lentil meatballs pretty soon because they look really good, and your pinto gallo that Bonnie made up the other day. I'm going to be doing that. But there's so many excellent recipes out there, and so I just, for overall health and for prevention and everything, for the animals and the environment, there's just so many good things that happen to the earth and then to your body when you can change to this way of eating. So
you started to do more exercise. Was that just because you felt like you had the energy, or like, were you active before, or was it a new thing to start running or do other activities?
Yeah, I always liked to exercise, and then I got into like a busy job, and I wasn't exercising as much as I like to. I always like to move my body, and then what I decided, as soon as I took that time off work to do research, I also started exercising a lot more because I felt like I had all this, like, I'm like, I've been wanting to, but I was busy with my work and I wasn't able to. So I had a lot of backup, just need to exercise. And so I immediately started exercising when I took that time off. In addition to my research, I was doing exercises as well. And, as I was going through that whole process, I noticed that my energy increased and I was able to do a lot more. Like, when I do these bike ride, this one bike ride every year, the Mama Jamma ride, and I did 56 miles the first year while I was going for radiation treatments. I did 56, and I was on my old very heavy bike. And then the second year I did 75 miles, and the third year last year I did 100 miles. And so I'm going to do 100 miles this year, and that's just continuous riding. It's an all day, supported ride, and it's great. Like, they offer food during the ride, but because of the way I eat, I didn't want to eat it. Because I'm strict about my diet. I didn't know they were going to put food, they were going to put oil in it and meat and all that. So I just stuffed a bunch of potatoes and sweet potatoes and dates all in my pockets, like a whole day's worth of food. And I would stop every now and then. I would just eat some of them. And then I would stop for water every 15 miles and refill my water bottles with their water. But I felt so great. I mean, I recovered so quickly after that ride. It was just amazing. Like, I was just working around my house. I got home and I just worked around my house getting things done. And the next day I got up and I didn't feel anything. It just felt like a normal day. Maybe my legs were a little sore. But I mean, it was great. I definitely noticed major improvements in my ability to recover from, exercising.
Yeah, I've heard a lot about the athletes talking about recovery, which is maybe starting to get a little more well known as far as like the vegan diets, because that's an important aspect of athletic efforts, is to recover quickly, to be able to work out again, to be able to ride or whatever the activity is. And I think that there's people like Brendan Brazier, there's people that wrote Thrive, and these runners in long distance that are starting to hopefully promote that aspect of athleticism, because in certain areas like bodybuilding, they might think, well, they're not getting enough protein in that,
Yeah.
but we're starting to show, at least definitely in more of the long distance cardio, that the recovery is very shortened and allows people to train more and stuff like that.
Yeah, it's been really good. Like even like I twisted my ankle, I think the beginning of last year, and my ankle was sore, so I just stayed off it for a few weeks. But then I was able to start running again, and that's fine. And yeah, I get little things, I might, I think on our trip I might have done the snorkeling a little much, and I was using those fins a lot, and I had a little pain in my other ankle, and I thought, oh, how long is this going to last? But it only lasted like 2 or 3 days after I got home, and then I was like, all right, it feels better. I went, and now I've been running again, and I don't feel anything. So it's like even injuries, I think they just heal. They heal so much faster.
Yeah, yeah. Like with the cancer and that, I think the general understanding is that you get this localized cancer, and you want to get it before it spreads, and then if you miss it, then you go into chemo and stuff like that. But it
Right.
seems to be more of a manifestation, like it's a systemic issue, that just manifests in
Yes.
one place or another. It doesn't start necessarily. It's not just originating in that spot. I mean, there's blood
Yeah.
and things floating all over the place. So I just um, I think that like when you were looking at all the research and there's so much confusion and conflicting stories, like what would you tell somebody how to find the correct or the best approach when there's so many conflicting. I mean, even with meat, I know people that don't really believe what we're saying, and so if you're trying to present them some information that, like, that's partly why I do these videos, is to help people that can hopefully find these. But if this is part of a larger amount of information that is confusing or conflicting, how can
Hmm.
they find the truth? From our perspective, when there's so many conflicting
Yeah, I
things out there.
know. I know. It's like for me, I wanted something that just made sense from a holistic percent, because there was a lot of stuff I would read, like, one day, Science Daily is some, thing that they talk about new studies and things that find this or that. But then it's like, every day, like a new study would come out. Oh, like this is bad for breast cancer, but this nutrient is good for breast cancer, but this one is not good. But it was like, so I felt like one day I was buying hemp seeds, and another day I was buying goji berries. I was like trying to get all these superfoods I
Right.
kept reading about, I felt like I was driving myself nuts. I was like, this can't be. It can't be this goji berry is going to make thrive. But it was the China study that T. Colin Campbell wrote that just presented the whole case for why going plant based, and then his book Whole was explained it from like a holistic nutrition from a holistic perspective, and he talks about looking at these single nutrients and single superfoods and stuff, and that's not going to be your answer. When you eat a whole food plant based diet, the whole diet is a superfood. And that's what just really made me relax about, I don't need to worry about this or that. It's like just from an overall perspective. So those books were really, those are, of course, my entry into this, and those are the ones where my light bulbs went off. But there's a whole lot of other books, like, McDougall's The Starch Solution, and then for women that have some women's issues or concerns or whatever. He wrote the McDougall Program for Women book, and that's a really old book, but he told me a lot of the information is like 99% of the information is still current in that book.
Mm.
And so that's a great book. And just like there's just so much science, and there's the Physicians Committee for Responsible Medicine, like Neil Bernard wrote a great book on. That's also a very good book on. It's called the Cancer Survivor's Guide: Foods that Help You Fight Back. And that's also a great book. It's full of research, and and they all, just the weight of the evidence, prove that the plant-based diet is the best way to not only prevent cancer, but prevent recurrence if you've had it, and also um, uh, also support, remissions of cancer, and extend your life, So it's just such important information out there. I wish that oncologists would get on board with this, with this information. I mean, there's no harm in telling somebody to eat a plant-based diet and telling your patients to do that. With all the information out there, I don't know why they're not. I think it's very sad, that they're not, oncologists aren't recommending this diet for their patients.
Yeah. Yeah, like when I looked at the China study, and it's an epidemiological study, but I think those are really useful because you can see when people migrate to different areas, or people that were in different areas, and there's that blue zones that talks about what people eat, basically a high plant-based diet.
Yes.
There is some meat. Sometimes they have like 5% or some low percentage of animal products. It's like a special occasion, or it's just a condiment. It's not a huge part of the diet, but that's why, like China study and things like Starch Solution, where you realize that there's areas out there that don't have, like, because we just grow up thinking, well, you get cancer, it's just the luck of the draw, and then
right, right.
And then you find out all these other cultures don't have the breast cancer, don't have the osteoporosis and the heart disease. So then you start realizing, okay, well, and then when they move from China to other places, they start getting those diseases. It's not really just a genetic thing; it's a lifestyle thing. And some people in the past, they always thought cancer was like an environmental, from the water or from the air. But Dr. McDougall points out that what we eat is the most intimate contact, compared to air and water. Like, food is going in our body and becoming part of us. And people just don't want to think about diet as being, have any benefit at all. They just don't. But it's like they think about the environment. So one of the things, like with Whole and China studying that, is where the idea of that we all have cancer cells, but it's the promotion phase where the food kind of promotes it. That's another useful point, that it promotes. So you can think, well, yeah, all of us have cancer. We all get exposed to toxins and things, and genetic problems. But the food can promote the growth. That was a key.
Yeah, that was a very eye-opening reading about that. Like, he had his animal studies, but still, like, Carl, it's consistent with everything else he found. But he had his rats, and he gave his rats, he exposed both the rats to equal amounts of carcinogen. But then he gave one set of rats the animal protein, and the other set of rats the vegetable protein. And both of them equally exposed to chemical carcinogens. The ones with the animal protein grew the tumors, and that killed them. And the ones that ate vegetables, like, were thriving. They were 100 days older, while the other ones were dying. The ones with the vegetable protein, were just thriving. They were still mating and everything. He said their coats were lush and everything. So, just it made me feel like, oh, well, then it's definitely the food. Seeing that, and it's, a lot of people worry about organic and making sure their beef is grass fed and everything, but the grass fed beef still has stuff in it that raised your IGF-1 in your body that promotes cancer growth. So even if your beef is grass fed, yeah, it might be a little worse for you, but it still has all the things in it that promote cancer. So I'm, definitely staying away from that. Just now I know, what, now I have all this proof and evidence of what causes it and what promotes it. And it was just amazing the way he pulled it all together in his China study book.
Yeah, I think that a lot of people get confused by nutrition, let's say, in general, because they're looking at different. They're hearing things on the news. They're looking at websites like newspaper or even blogs, and I think that
Yeah.
what I would sort of suggest is people go deeper, to look at the studies, because you're going to hear people say things on both sides. And, when those people talk to you about eating meat or dairy, I think that's an authority figure. And if you accept that, if you accept what the doctors and the oncologists are saying, then you're just going by them and their authority in that area. But to look at the, and beyond the blogs and the websites and these authority figures, and look at the science, that's probably the best. Like, look at the studies. A lot of these things make a lot of sense to me. Like, with China study and the migrations and these actual studies, versus just, being confused by alternate views out there. Because otherwise, I'm just trying to help people, like, how do they cut through the noise and find the best solution. And I think the studies are probably come closest to that, because even studies that show, sometimes they'll show like that meat or dairy is helpful. You can start to see all sorts of problems with the study, like the way it was designed or who sponsored the study. And so you can sometimes, even studies can still sometimes show alternate viewpoints, but you have to really, I found, like, to go right at the study and start looking at it, and you start seeing how they design the study. Like, sometimes a study will show that something is good, but they compare it to something really bad, so they have two bad choices, and so
it's less bad than the other choice.
Yeah, and it makes it look good, and then there's who sponsored the study. So those are, it's a little more technical, but at the end of the day, you got to drill down a bit further, because I find when you're just kind of looking at websites and trusting, these sites, that you don't really, you can be really confused. So
that's exactly where I was. A couple of years ago, I was like, well, I never really researched nutrition, but I thought I had a good instinct about it before, and being healthy, making sure I ate my vegetables and the brown rice and stuff, and never knew about oil. But so then it was like I was shocked into this whole world where I needed to understand nutrition more. And then that's when I started going to these websites, and I was like, well, the websites seem pretty authoritative, but I'm not an expert in researching studies, and so it said there's a study, so that's about as far as I went. But then I learned in Colin Campbell's books, and also in his course, that you need to look at who's funding the studies, and how are they doing the studies, and that's very, you have to drill deeper, and most people don't drill deeper, and they just see what's on the headlines and on the news and what's in the paper, and they just think that's, Time magazine, they drive me crazy, because they have, they just put the craziest stuff on the cover, like, butter is good for you, and then my husband sees that, and he's like, there it is, verification, butter is good, there you go, it just like pretty much is against everything, I've been studying and researching, but I'm like, no, and then of course, there was stuff came out later, showed that was pretty ridiculous, that butter recommendation, but you just can't forget, the cover of the Time magazine has a big pat of butter on it, and that's just what's in most people's minds. Oh, it's okay. Time magazine said it's okay. Let me go ahead and put it in my cart.
Yeah, and then like afterwards, it's like a retraction, or even a rebuttal that nobody ever sees. But like they looked at the meta-analysis, every study in that meta-analysis, and showed that that it's not really the way it was purported to be. But so we're fighting an uphill battle, because the money and people want to sell the magazine, and people like to hear, as Dr. McDougall says, bad things, or they like to hear good things about their bad habits. But just finally, like if you had a local cancer, or like recurrence, God forbid, or like or spread, or you found, or something that had spread, what would you or Dr. McDougall, what would they do at this point? Because you're eating a plant-based diet at this point.
Yeah, that was actually there was a book that Dr. McDougall, like when I wrote him my question a few months ago, he recommended I read this other book. My question being, do I need to go for these mammograms and all these oncology checkups? And he said, no, not really, but you might want to check this book out. And this is an old book, but he said it's like 95% I don't know, he looks backwards, but anyway, it's a challenging second opinion. And anyway, he wrote it in the 80s, but he said like it's 95% still accurate and good to read today. So, I read that on my way down. I wrote questions in the sidelines, and then I talked to him about it after his cancer presentation in Costa Rica. Anyway, there was one very startling statistic in that book, and it said that women who are diagnosed with breast cancer, this study showed that followed them for 20 years, and it said that I don't know if it's one or multiple studies, but it concluded that 80% of them are dead in 20 years. And of the 80% of the women that are diagnosed with breast cancer in 20 years, 88% of them died from breast cancer. And so I was like, wow, that's a really startling statistic. Do you think that's, you think that's still true these days? And he said, yeah, it still holds true. And he said it's actually those who died from breast cancer, it's a bit worse for women who are, my age, like younger. And so that was, so then I was like, okay, so what do I do if I have a recurrence? And what he recommended is if it's a local recurrence, if it's in the breast, just have it removed, have the tumor, have a lumpectomy. If it's small enough, the least amount of surgery is best. Don't have a mastectomy if you don't need one. If it's spread around a lot and you can't avoid a mastectomy, have it. But if you can do the minimum amount of surgery is best. Don't do any more radiation. I've had enough. And if it shows up in the other breast, I'll totally refuse the radiation next time. And no chemo. Don't do the chemo since the studies show it doesn't help anyway with survival and does more harm than good. So that's for that. And then as far as like distant recurrence, if it should show up somewhere else, it's I even wrote him afterward, and I was like, okay, so what about distant recurrence? And he responded to my email pretty quickly, and he talked a lot about local recurrence, and then he just told me just plan on living a long and healthy life, And I was like, well, so when you said plan on living a long and healthy life, is it because, I'm already eating this diet, or and he was like, and I think what he's getting at is, I'm already doing the most that I can do, and I told him I'm very strict about his diet. I'm not having cheat days. I'm not doing moderation or anything. I mean, I'm full blown low fat, starch based diet. I'm there. I don't eat oil. When I go to restaurants, I'm very clear, about what I really don't eat out very much. But anyway, doing all I can, and he told me just plan on living a healthy life. He doesn't think it's going to be an issue with me. But, in the back of my mind, I'm like, if that should happen, if I should have it show up somewhere else in my body, like in an organ or something, I think probably the first thing I would do is call True North Health Center, which is True North something, and they're in California, and it's like they do medical supervised fasting. Because I know fasting worked for a friend of mine who had ovarian cancer, and she cured herself of that. She's cured. And she did a fasting over in India, and she has an amazing story. But, so that's probably what I would do, is I would do that medical supervised fasting and give that a try.
Yeah, that's what I was thinking too, because like for a systemic, for anything that's spread, because there might be people out there that are doing maybe not as strict as you, like, but pretty much. There's probably some things that they could tweak, as far as cutting out any of that potential of processed food or anything, and then adding more veggies or stuff like that. But yeah, that's what I was thinking too, is the fasting, because it gives your body a chance to completely focus on healing.
Right. Yeah, it's like I've listened to a few interviews of Dr. Goldhammer, and he was saying there's just amazing stories where it's like if you want to reset anything in your body, that's like the most efficient way to do it, is to do like a fasting. And I thought it would be good to go to a place where it's supervised. I feel like it's, I'm not starving myself to death, like somebody's actually watching, and making sure I'm still healthy as I'm going through the process, and just having that kind of support, I think would be really good.
Yeah. Okay. Well, I'll probably I'll definitely put the books that you've recommended under the in the description of the video, so people can check those out. Is there anything else that you'd like to mention? We've covered quite a bit here. Hopefully, people are. Hopefully, this will help people, find those resources and realize that there's alternatives to chemo and radiation and mastectomies and things like that. And
Right.
And so.
Yeah, let me see if there's anything else. I got my little list. Yeah, definitely the books. Like these are like the books that I recommend, and I'll go ahead and I can put those, or if you can put them under there, that would be great. Those are some of the books. I don't know if I have all of them there, but they're great. They're really great books. Just having information is power. Knowledge is power, and nobody explains breast cancer as well as Dr. McDougall does. He spent a lot of time. I think he's just an advocate for breast cancer, and he does a very good job. And I really appreciate that he explains it so well, complete with how it starts from the progression to the diet you should eat to live a long and healthy life, and so that's great. And then just having this knowledge, I feel like when you've had a cancer diagnosis, it's easy to feel a lot of fear about recurrence, and going to doctor appointments and getting checkups and all the follow-on stuff. But when you have some information and when you feel that you're doing all you can, it really helps, to eliminate that kind of fear, feeling like you have something over you all the time. So I feel like I found my way out of that through all this research, and thank God for all these doctors and scientists that have all this information out there for us to read, or else I would probably still be living in fear and confusion, which is just a terrible place to be.
Yeah. I think we're really lucky, and like you say, like Dr. McDougall answers emails, and people can go see him as well, and if they wanted to, like at various of his events, that I definitely recommend that people talk to him and try to meet him if they're in this situation. Or,
Definitely, yes. I feel like, okay, well, instead of spending my money on scans and oncologists and all that, I'm going to use my money and spend it on a vacation retreat. It's like he must have had this vision a long time ago too. He doesn't want to be the kind of doctor who's just treating patients and they're not getting any better like most doctors, but he wants to be the kind that makes them well and enjoy their life. And hey, why not go into the tour guide business in the process and just hang out with these people? I thought it was so great. I met so many people in that retreat that just, this woman had MS, and she's like in her 70s now. She had it since she was 13, and she used this diet for the past 25 years, and she's been thriving from her MS. And another cancer survivor, and so several cancer survivors who've improved on this diet. So they're thriving, and it's very inspiring.
Yeah, Nina had the rheumatoid arthritis. There was also different. That's what I noticed. I didn't expect that. Almost, I was wondering, like when I went down there to Costa Rica, if it would be like people just starting or thinking about going to McDougall, approach plant-based,
Right.
starch-based diet. And then I thought, well, there's got to be some people that have gone to different trips, repeat visitors, vacationers. But I didn't expect. And then a lot of times, like they focus more on heart disease and things like that. So meeting you and others that had like cancer and MS and diabetes and
Mm-hmm.
kidney disease, it was unbelievable. And these people had um, managed it with this diet. So it also kind of reconfirmed to us that, you know, to stay doing this, like, because you see that
Right.
they had gone through a worse. Uh, you guys had all gone through terrible um, events and managed to reverse and manage a lot of that through the diet. And so, you know, definitely reaffirmed to us that, you know, this is the way to go as far as the diet. But I definitely, yeah, we really like talking to you, and your story I think is going to help a lot of people. You know, that's what I try to do here, is just to spread the message and give people information and, you know, hope as well, to if they have any of these issues, that they can take control of them and you know, hopefully prevent them from happening.
Right. Yes. Thank you for having me. I always try to spread the news, spread the word, but it's very hard. So I appreciate you giving me this forum. I really do.
Yeah, no problem. I'll probably yeah, I'll be put this up pretty soon here, and hopefully get the message out. That's all. All we should do in our life is just, you know, keep passing the information on, and hopefully people, you know, get more and more receptive to the message.
Yes.
Thanks so much, Patty. It's been great chatting with you.
You too, Will. Thank you.
Okay, talk to you later.
All right.
Bye bye.
Bye.